Hi, I'm Dr. Laura Huckins. I run a research group in the ICANN School of Medicine, and I'm an assistant professor in the Pamela Sklar Division of Psychiatric Genomics, the Department of Genetic and Genomic Sciences, and the Department of Psychiatry. To really understand COVID-19, we have to understand its spread. A lot of the data that we've seen so far is coming out of China, from Italy, and Europe, and in the US, it's coming from patients who are hospitalized. We need to go beyond that, and we need to understand how this disease is spreading through our New York City community. We know that New Yorkers are unique. We're a diverse city. We live in very dense quarters. It's really important for us to understand what's going on right here in our community today. So we've created the STOP COVID-19 survey. Any New Yorker can text COVID to 64722, and you're going to receive a simple text prompt. It's a quiz that will ask you every day about your symptoms. Things like, do you have a fever? Do you have a cough? It's really important that everybody fills this out. If you're healthy, we need to know that. If you have mild symptoms, if you're really sick, we need to know that too. This is for everybody. It's about everybody. And the goal of that survey is for us to be prepared. That's going to help our local doctors and our local hospitals know where the hotspots are throughout New York. It's going to help us be more prepared for patients coming in. You're also going to receive a longer survey, and you can fill that in at any point. That's going to ask you about some of the known risk factors for having a worse course of COVID-19. So things like your age, whether or not you smoke. We've also collaborated a lot with some experts at Sinai in infectious disease. We've asked about possible risk factors, things like asthma, whether you have an autoimmune disease. These things will let us help all of the USA. We know that New York is at the very beginning of this. We know that the rest of the US is going to be hit in the coming weeks and months. If we can start to understand now who is most at risk from COVID-19, maybe even who's protected a little bit from COVID-19, that's going to give us the tools to help all of the US in the coming months.